Hello, my name is Jessica Jhanley, and I'm a senior athletic training student at Florida Gulf Coast University. Today I will be demonstrating how to conduct a SCAT5 concussion assessment, so we're going to begin. First, if I saw a concussion or an athlete go down on the field, I would first check that the scene was safe and then go out and start treatment. Red flags that I would immediately check to refer the athlete before going through this form would be neck pain or tenderness, double vision, weakness or tingling, severe or increasing headache, seizure or convulsion, loss of consciousness, deteriorating conscious state, vomiting, increased restlessness, agitated, if they become agitated or combative. So if I saw any of these, I would immediately refer them and not go through the form, call 911 and have them taken to the emergency room. So going up to the athlete, you check and see if first they're responsive, if they're awake, their vitals, so if there's any immediately bleeding or deformities, and then go from there. And if you can get them off the field to the sideline, you would begin this form. So some observable signs, if they're lying, and you answer yes or no to all of these questions, lying motionless on the playing surface, their balance or gait difficulties, motor incoordination, stumbling, slow labored movements, disorientation or confusion, or any ability to respond appropriately to questions, blank or vacant look, facial injury after head trauma. So all of these you would answer yes or no to on the form and go from there. The third step on our process is memory assessment MATIC questions, which again are yes or no. You would ask this athlete any of these questions to see if they have the short-term memory to know where they are and what's happening at the time, and they answer. If they can answer, then if they answer incorrectly to any of these, that is a sign that they are possibly concussed. So the questions being, what venue are we at today? Which half is it now? Who scored last in this match? What team did you play last week or last game? Did your team win the last game? And you can make these more specific to the sport that's being played or the athlete that has been injured to make the questions more pointed and more specific to them. So moving on from there, we're going to step 4, which is the Glasgow-Coma scale. And this scale, the first is done on the sideline, and the next two trials are done later on to check if the athlete has improved from that point. So you're going to be going on a scale of 1 to, it depends, 1 to 4, 1 to 5, 1 to 6, depending on which thing is being tested. So for the first, it's eye response, and 1 being there's no eye opening at all, 4 being eyes opening spontaneously or being able to just normally open your eye on command. Best verbal response, so 0 or 1 being none at all, and 5 being oriented and being able to respond appropriately and correctly to the questions that are being asked of them. The third is on a scale of 1 to 6 with best motor response, so 1 is none, and 6 being obeys commands on command, so you're able to do what's asked of you physically and pick things up, set down, move where you're being asked. So that's the Glasgow-Coma scale. And next is the cervical spine assessment. These are yes or no questions that the athlete answers relating to their spine and how it's feeling. Do they report that their neck is pain-free at rest? If there is no neck pain at rest, does the athlete have a full range of active pain-free movement? And is the limb strength and sensation normal? So all of those would be on a yes-no answer. And again, 1 is done at the time of injury on the sideline, and another time this test is given is later on. So moving on, this is when you'd go further into the athlete's background. So this is an office or off-field assessment part of the SCAT5. Step 1 is the athlete's background, so it's about them, their team, school, their age and gender, things that they would be able to fill out themselves later. And then also a little bit of their past medical history. So there's a section yes or no for have you ever been hospitalized for a head injury before, diagnosed or treated for headache disorder or migraines, diagnosed with a learning disability or dyslexia, diagnosed with ADD, ADHD, diagnosed with depression, anxiety, or other psychiatric disorders, and if they're on any current medications, which could affect the way that a concussion symptoms are being presented, or if they're being accentuated by the fact that they're taking some sort of other medication. Step 2, on the part that the athlete would fill out themselves, is the symptom evaluation. So this is done on a scale of 0 to 6, 0 being none and 6 being severe. And some of the examples of these are headache, neck pain, dizziness, feeling slowed down, irritability, sadness, and the athlete would go in and have done before a baseline for this, but post-injury they go in and fill this out again. And it's out of 22 symptoms, and then the severity is out of 132 points, depending on 0 to 6 how many they filled in. And from that point, you would give them a grade. There's questions at the bottom. Do your symptoms get worse with physical activity? And do your symptoms get worse with mental activity? Yes or no? So if 100% is feeling normal, what percent of normal do you feel? And they would be able to give at the end a percentage for that. So, and explain why. So from this, the scoring, depending on what they give, can be conclusive for the severity of their concussion and how long you think the symptoms might last. So, going on from there, we would go to cognitive screening and orientation. So this is another standardized assessment of concussion, the SAC test, and orientation part being if they can get what month it is, the date today, day of the week, year, what time is it right now within an hour, and from that point, if they're correct or not, they get a scale of 1 to 5 or a grade of 1 to 5. And the 0 being really bad and more conclusive that they might have a concussion, 5 being good and their cognitive level is good right now. Their immediate memory, these are tests that are done with words and numbers in memory. So I'm going to begin by listing out 5 words in order and have my athlete repeat them back to me. So, all right, I'm gonna begin. The 5 words being finger, penny, blanket, lemon, insect.
Finger, penny, blanket, lemon, insect.
Awesome. Okay, so from this point, you can do 3 trials with them on this depending on the time. So this is the first trial. I would go through this list along with 5 other lists of the same words, and I would put them in different orders, go backwards, skip one, and have the athlete repeat them back to me. They get a score of 1 to 5 for each trial, and an immediate memory score at the end out of 15. So this is a building from having done it as a baseline to now to see where they're at cognitively and memory-wise. And then there's also the exact same test, just done with 10 different words. So, and that's out of 30, so it's just another building block from this point. Okay, the next test being numbers. So we're going to do something very similar just with numbers. And these are in lists of 3, like sets of 3 numbers in a set of 3 sets of 3 numbers to begin. And then as you go down, you can get to a set of 3 sets of 4 numbers and 3 sets of 5 and even 6 numbers. So it's all a building process. And from that point, you get a yes or no. If you got it right, score. And then at the end of a trial of 3 sets, you get a score. If you got all 3 right, you get a 1. If you got them wrong, you got a 0. And at the end, your digit score is out of 4. So I'm going to have Carly go through 1 of the 3 sets of 3. And could you repeat these numbers back to me in order? 493.
493.
526.
526.
And 142.
142.
So this is how we would go through those lists. Moving down, you could go through the sets of 4 numbers or 5 or even 6. And then there's a whole nother section at the bottom for you to be done later with a progressive to see how they've gotten better from this point. And then same with the months. We have the athlete repeat the months in reverse order. And I'd honestly ask you to see if you can do that. Can you do that?
Let's see. December, November, October, September, July, June, I forget August. So September, August, July, June, May, April, March, February, January.
Beautiful. Okay, and then they get a month score, and it's all or nothing, so 0 or 1. So Carly caught herself. She got a 1. Awesome. Okay, and then we got a neurological screen that we would go through, and they're all yes or no questions. Can the patient read aloud and follow instructions without difficulties? So we've been good so far. Does the patient have a full range of pain-free passive cervical spine movement without moving their head or neck? Can the patient look side to side and up and down without double vision? And can the patient perform the finger-nose coordination test normally? Can the patient perform tandem gait normally? So all these are yes or no, and the last part of this physical exam would be the balance examination, or the BEST test, modified balanced error scoring system, in which the athlete goes into a double leg, like 1 foot in front of the other stance, and we're going to demonstrate that if we can real quick. So Carly's going to stand with 1 foot in front of the other, and from that point you're barefoot and it's on a hard surface, and then you're going to go into double leg stance with your dominant foot forward. There you go, and hold on, you're going to close your eyes, and it's for the balance of that. And then she would repeat it with her non-dominant leg in the front. Perfect. Sorry. Sorry. And then, yep, you're pretty good. You're good. Sorry, thank you, Carly. And then one very last thing is the delayed recall that you would repeat at the end. So you'd have the athlete repeat the words that they did at the beginning of the test right here at the end, again, just to see how many they can bring to mind. And then, yeah, that's pretty much our SCAT5 form. From that point, you go in and enter all the numbers and give them a grade. So you decide at the end with the decision part of the form, depending on the symptoms and the amount of numbers that they got, if they're more likely or not to have a concussion. So looking at the cognitive side, the memory side, and the physical side, if any of those show a very big difference from their baseline, or have changed so drastically that it's affecting their day-to-day life, there's a very high chance that they have a concussion and shouldn't go and shouldn't participate in practice or anything, and go through this process of building day-to-day one at a time to see if they can get back to where they should be and have a less risk of second impact syndrome and receiving a second impact of the brain that would cause even further damage. So, thank you.